If you consent to a cervical check and all you hear is how many centimeters dilated you are, you might be missing out on a lot of information. Find out how to get the most out of this rather invasive procedure and when it might actually be worth it. Welcome, I'm Ellen Contard.
And I'm Melissa Evans.
We've been supporting growing families for a long time.
We've come to realize that quality childbirth classes are really hard for growing families today, both in terms of calendar and budget.
So we've decided to do something revolutionary. We are offering our full, comprehensive childbirth class series right here.
Please realize that we are not medical providers nor attorneys. We do not practice medicine nor the law.
So use common sense and talk things over with a professional that you trust.
But for now, let's take a more in-depth look at cervical checks, when and if they might be useful.
Along with timing contractions, cervical checks, also known as vaginal exams, can give us some insight into our labor progress. It's important to understand when it's a good idea to do a cervical check, what exactly it can tell us, and what the risks and limitations are so that we can make a truly informed decision about whether to consent to one.
Some care providers might like to start doing vaginal exams late in pregnancy to perhaps give them an idea when labor might be starting. Some things that they might be looking for are both position and ripeness. When birth is not imminent, the cervix tends to be aimed more towards mom's tailbone, which is clearly not very useful for birth. But when mom's body is starting to prepare for the big day, it actually starts to move up and align with the birth canal. Much more useful. Another thing to consider is how ripe or soft the cervix is. When the cervix is doing its job, staying nice and close to keep baby protected, the cervix is hard, like your forehead. As birth becomes more imminent, it softens, like your nose, and when it's really close, it's squishy, like your lip. When birth is in process or even very imminent, the cervix can be nice and mushy, like the inside of your cheek.
Truthfully though, cervical checks in late pregnancy are a little bit limited as to how much they can really predict about when labor is going to start. A mom can have a very long closed, unripe cervix, and she can be holding her baby just a few hours later. Or a mom can be running around with a cervix that looks like it's just about to let this baby out for weeks. While some care providers will do cervical checks in late pregnancy, starting around 38 weeks as a matter of routine, this is a great time to pull out those questions we went over in our video on informed decision making. Is doing a cervical check right now really a good idea? If you consent to one, what will you do with that information?
Late in pregnancy and throughout labor, the star of the cervical check is dilation, or how far open the cervix is. Throughout pregnancy, the cervix stays nice and closed to keep baby protected. But as labor begins, and sometimes in pregnancy, it starts to open, up to 10 centimeters dilated. That's kind of a bit of a misnomer. Some babies clearly require more if they happen to be big, and some might only require 8 centimeters if they're on the small side. What we're really looking for is complete. Is the cervix totally over baby's head or not? Sometimes in pregnancy, mom might get up to 4 centimeters. It's kind of like getting a free bonus, so take advantage of that. Even though dilation is so heavily focused on during labor, remember that there are other things that can be happening. We talked about some of them in our stages of labor video, but also consider ripeness and position, and we're about to talk about effacement too.
The cervix starts out long, hard, and closed, and as things progress, the cervix softens, dilates, and effaces. Effacement is the thinning out or shortening of the cervix, and it's measured in percentages. So a completely long cervix that's probably closed is 0% effaced, and it's really only a couple of centimeters long. A cervix that's completely thinned out and basically gone is 100% effaced. So you can see there's not a lot of room to put all those percentages in. In a first baby, generally effacement will be complete long before dilation. And there's a good reason for this. Check out this model. No, I'm not showing you a cervix. This is a rubber band. So when you have a long, thick rubber band or a long, thick cervix, it takes a lot more force to open. When you have a nice thinned out rubber band or cervix, it takes a lot less force to open up that rubber band. In second or later babies though, all bets are off. Effacement and dilation can pretty much happen at the same time.
Another useful piece of information that can be gathered during labor is baby's station, or how low baby is in mom's pelvis. Our pelvises have these little bumps here. We don't really know of anything useful about them, except they are a great landmark for determining where baby is. Measured in centimeters, if baby's head is even with these ischial spines, that is considered zero station. Negative station means baby is above, and positive station means baby is below. So -4 means baby's kind of floating in the uterus. +4 means baby's head is crowning. All in all, birth is about a 4-inch journey. It's kind of the longest time it takes to move such a short distance. Until they're toddlers.
One other thing that a vaginal exam can tell us is baby's presentation, or what part of the body is coming out first and how it's facing. For purposes of this video, we will assume that baby is vertex, or head down. The care provider reaches in and finds a suture, or one of the cracks between the 5 bony plates of the skull. They follow along that suture until they reach a fontanelle, or one of the soft spots on baby's head. They use that information to tell you which way the baby is facing. In order for this information to be gathered, direct contact with baby's head is needed. So if mom's waters are still intact, this information may not be available. Also, the cervix does need to be open enough for a care provider to reach up in there and grab the head.
As you can imagine, or might have even experienced already, these cervical checks are not particularly comfortable. And unfortunately, they do carry a few risks. Everything was designed to come out of the vagina with one exception, and it was not the gloved hand of a care provider. It does actually allow bacteria to be pushed back up that were trying to be flushed out. So now the chance of an infection actually does increase. So does the chance of mom's bag of waters breaking. And if the bag of waters is already broken, then the chance of infection goes up a little bit more as well. There's also a slight chance that a care provider might strip or sweep mom's membranes without discussing this with her. It's kind of a mild form of induction that can be done in late pregnancy to irritate mom's uterus into starting to contract. Although it's not a horribly invasive method of induction, we do find it a little bit bothersome when care providers do this without talking to the owner of the cervix. So because of these risks, we really do encourage you to look at the risks and the benefits to see if it's a good idea for you to do an exam at this point. If your care provider insists that they have to do one because it's been 2 whole hours, that's not quite an adequate enough reason and rather a red flag.
Arriving at the birthplace can be a really great time to consent to a cervical check because it helps answer the question of the hour. Should I stay or should I go? If mom is 5 or more centimeters dilated, it's generally a good idea to stay. If mom is less than 5 centimeters dilated, assess the big picture. What does her contraction pattern look like? More importantly, how is mom feeling and behaving? What does her gut say about where she needs to be right now?
Making a decision about an intervention might be another good time to have this data. If mom really wants an epidural and finds out she's at 9 centimeters, it might not be worth it. If she really wants an epidural at 5 centimeters, that could change the equation. If a care provider would like to break the bag of waters when baby is floating at -3, that might lead to an increased risk of cord prolapse. Not a good idea. But if baby is at +2, maybe that would reduce the danger.
If mom or a member of her team suspects that baby might be in a position that makes labor take a little longer or be less comfortable, a vaginal exam to more accurately assess baby's position might be indicated. Also, when mom feels like she's ready to push is a great time to do a cervical check and make sure that she truly is completely dilated and ready before she adds her own effort to the work that her uterus is already doing.
Of course, if mom has a burning desire to know that number, her sanity is worth something too, and getting that information might put her at ease. Just know that you do have the right to say no. It's your vagina. Just because somebody is wearing scrubs or has a stethoscope around their neck doesn't mean you have to let them in. Another option some moms find useful is to allow the care providers to do the exam so the care provider feels good, but the mom doesn't necessarily have to know the number. Sometimes ignorance really is bliss, because if mom hears that she's still at 6 centimeters, it can be very disheartening. And then if mom gets depressed, then it can actually negatively spiral her labor.
There are also some alternative methods to assess how much mom might be dilated without exposing her to the risks of rupture of membranes and infection that cervical checks can bring. One of these is the xiphoid check. At the peak of a contraction, mom wants to see how many fingers she can stack between her xiphoid process at the tip of the sternum and her fundus, or the top of her uterus. As the uterus contracts, the muscle fibers pull up and stash muscle into the fundus, causing the fundus to get thicker as the cervix gets thinner. So, every finger that she can't stack in there is worth about 2 centimeters. If mom can only get 3 fingers in at the peak of a contraction, that means she's probably about 4 centimeters dilated. If she can only get 2 fingers in, she's probably close to 6.
Another visual way to get a ballpark idea of how open her cervix is the magical purple line. So as baby's head descends and blood changes, we're not entirely sure of the exact process here, but there is a purple line that will go up from mom's tailbone up to her spine, kind of between her bum cheeks. We never said labor was glamorous, okay? All right. Clearly, mom won't be able to check that for herself, but anyone behind her, perhaps doing a hip squeeze, remember those things are awesome, can have a good idea that labor is progressing. The higher the line, the more dilated mom is. Also realize it's actually quite possible for a mom to do her own cervix check. It is her cervix after all.
Remember that those emotional signposts we discussed in our video on the stages of labor can often be a much better indicator of where mom is than contraction timing or even cervical checks. It's important to remember that big picture.
There you have it. Some information on cervical checks, some alternatives, their risks, what they can tell you, and when they might be useful or not. What do you think? Will you allow them late in your pregnancy? Do you want them done throughout your labor? Let us know in the comments. We love to hear your stories.
Please like this video and share it with all of your pregnant friends. And do remember to subscribe. We'll be posting new classes every Tuesday and Friday, and we wouldn't want you to miss anything.
Until next time,
Know your options.
own your birth.